Those loud and angry healthcare town hall meetings continue to rage across the country, and it looks like things won't quiet down anytime soon. CBS News senior White House correspondent Bill Plante has the latest. Good morning, Bill.
Good morning to you, Harry. Those confrontations are one of the reasons that the president pushed Congress to pass health care before the members went home for a month. Now the opposition, organized or not, has a lot of questions and fears.
It reads like something that
with me. 99 control.
Opposition has grown beyond all expectation.
We are not moving to socialism.
Many Americans are angry or afraid that government action will lessen the quality of care and raise prices. The president has answered the charges, but the latest USA Today Gallup poll shows 34% of Americans say the demonstrations have made them more sympathetic to the protesters' views. The White House says the town hall forum is still effective.
The president believes that the town hall meeting is a structure where people can discuss those issues in a way that they think, the way that he believes engenders a positive discussion.
The president will take on his critics directly again, stepping right into it at town hall meetings in conservative parts of Montana and Colorado tomorrow and Saturday. Harry?
Bill Plante at the White House, thanks. So what is fact? What is fiction when it comes to health care reform? Jonathan Cohn is senior editor of The New Republic and author of Sick, the untold story of America's health care crisis and the people who pay the price. Jonathan, good morning.
Morning.
I'm going to get right to some of these questions, some of these hot button issues that get repeated and repeated and repeated day after day, especially in these meetings. We just heard the man say, we don't need Obama and his crew to tell us how to die. Is the health care reform plan going to create death panels telling people how to die? True or false?
Absolutely false. I think this is probably the most outrageous claim we've heard. There is a provision in the bills that are moving through that says if you want to write a living will, you want to talk to your doctor about it, you want to do it the right way, make sure you're asking for what you want.
Right.
Then Medicare will actually pay your doctor to sit down with you and do it so that you can have the time and the conversation. That's all. A voluntary conversation about living will, that's it. No death panels, no euthanasia, nothing like that.
All right. The administration says if you like your current insurance plan, you get to keep it. True or false?
True. The administration's plan basically says the whole point of this insurance plan is to tell people who have insurance you get to keep it. We're going to try to get insurance for everybody else. Now, the one catch to this is it may be if you have insurance from your employer, next year your employer might decide to drop it. No one can stop that.
Especially if there's a public plan to help replace this.
Well, you know, that depends on how they design the rules, but
sure.
it's possible. And there are some people who say if they design the plan certain ways, more people will end up leaving.
Right.
So that's where you get into the argument. But
Right.
basically, people will get to keep their coverage.
All right. Recently, a senator was confronted by a man who told him, keep your government hands off my Medicare. Is the health care reform plan going to slash Medicare benefits? True or false?
False. Of course, government runs Medicare. People sometimes forget that. Something else people don't know is that one of the things the reform plans will do is actually add a major Medicare service, which is they're going to fill in that donut hole, you know, that gap in Medicare prescription drug coverage. Now, Medicare, like all insurance plans, chooses what to cover, what not to.
Right.
And since it is getting to be a very expensive program, the idea is to give it more tools to make better decisions. Will that down the road lead to less services? Well, hopefully it'll lead to less expensive services. That's where the argument is. But there's no plans to slash benefits.
And by the way, Medicare could go broke within the next decade if
that's
something
why
doesn't
they want
change.
to try to do
Exactly
this.
right. You see signs of the protest line calling this reform plan socialism because it requires everyone to buy health insurance. Is it true that everyone will be required to get health insurance?
It is true everyone will be required to get health insurance. Now, I don't know if you would call that socialism. The idea here is simple. Reformers want everybody to be part of the system, but, this isn't free. It's not a giveaway. The idea is that people should have to pay what they can. So you ask everybody to go and get insurance, be part of the system, take responsibility, and pay at least what they're able to pay.
All right. And last but not least, the woman who introduced the president was denied health coverage because of a pre-existing condition. Will this no longer be the law or not the law? Will health insurance companies be able to still deny you insurance?
They will not be able to deny you insurance. In fact, that's the flip side of the deal of requiring you to get insurance. If we're going to require you to get insurance, we want to make sure insurers give you the insurance.
Jonathan Cohn, thanks so much.